Hi, I'm Danielle Wright. I am a public health practitioner and I'm also a social worker. The HIV/AIDS diagnosis crisis is an issue that's of concern nationally. However, African American women experience an exacerbated risk of contracting HIV/AIDS in the South. Some of the reasons for that are because of many of the social inequalities that African American women face. In order to fully understand how these factors contribute when they're coupled with issues like stigma, discrimination, and homophobia, we really have to start exploring how we can dismantle some of the stigma that exists in our community. African American women are living in shame and in silence and are not seeking treatment because of the horrific stigmatizations associated with having this disease.
Hi, my name is Rachel. I'm a ninth grader at Eleanor McMain in New Orleans. I think that it's important for teenagers to be exposed to sexual education in school because at home they're not always exposed to accurate information about sex and HIV and how to contract it. I also feel that teenagers aren't heard by people in powerful positions in our community. They may feel that what we have to say isn't as valid as someone else because of our age. Sex ed in schools is very important for teenagers because they are, in my opinion, more at risk.
My name is Dr. Rebecca Burke, and I am a palliative medicine physician working locally in New Orleans. I think our community needs to be more educated about HIV, the transmission of the disease, and the treatment options that are available. If that were more open and if the community was more educated about this, I think that they'd be more understanding that you should seek treatment. Unfortunately, I do see a good amount of HIV and AIDS patients. I say it's unfortunate because there are treatments that are actually very effective for HIV. So if you're seeing a palliative medicine physician, it means you've pretty much not taken any medicine and you've let your disease progress to AIDS. I will say the stigma that's associated with HIV prevents people from seeking care early on. And unfortunately, a lot of that is just passed down from whoever taught them about HIV, about AIDS. If you get on treatment, you can live a normal lifespan, especially if you're compliant with the medication regimen.
My name is Barriel Tate. I am in the ninth grade. I go to Edna Carr High School in New Orleans. I think that sex ed in school is important because we can't always talk about that at home with our parents because of judgmental reasons, or if you don't feel that you don't want your mother to know, so she won't look at you in a different way. Also because if you live in a household that's big on religion and they believe that you shouldn't even be talking about this until after marriage or stuff like that.
Hi, I'm Patrice Sams Abiadun, Dr. Patrice Sams Abiadun, I should say, and I work with Planned Parenthood Gulf Coast as their Vice President of Strategic Partnerships for the state of Louisiana. Well, I think this is a very important issue for us to support Black women in the South, and specifically here in New Orleans and Louisiana in general. A lot of women are living with that disease silently. They're living in shame, their self-esteem may be low, and that ultimately can impact their well-being and the outcomes that they have, from this disease. And so I think it's very important that we provide support to women who are infected, but also that we begin to destigmatize this virus, because you can live a long, healthy, and happy life now with the virus, but what we're finding is that many of our sisters are dying. We have so many sisters that are living in silence with it. They don't feel comfortable to come out to their family. So it is really important that we not isolate people who are infected or impacted by this. I'm just asking every institution that's so critical in our community and just women to stand with all Black women.